everyone. I'm Allison Silvers. I'm the Chief Healthcare Transformation Officer here at the Center to Advance Palliative Care, also known as CAPC. And today we're going to gather some guidance and advice from people who are in the world of foundation fundraising. I'm really excited to hear from our panelists. And with that, I'd like them to introduce themselves. Mary, can you get started, please?
I'm Mary Medill. I'm the End of Life Program Officer for the Morgan Family Foundation, and our funding is in the state of Minnesota.
Lauren?
Hi, my name is Lauren Weisenfeld. I'm the Deputy Director for the Healthy Aging Program at the Fan Fox and Leslie R. Samuels Foundation. We're located in New York City, and we fund only in New York City.
Hi, I'm Rachel Watman. I'm the Vice President of Programs at the Rita and Alex Hillman Foundation. We're located in New York City. We are a national funder committed to improving the health and the healthcare of marginalized populations.
Hi, my name is Siobhan Aaron. I'm a researcher and assistant professor at Case Western Reserve University. I was recently funded with the Rita and Alex Hillman Foundation and the Arthur Vining Davis Foundation for emergent innovation in serious illness and end of life. I am also an inpatient palliative care nurse practitioner.
Great, thank you. Well, actually, Siobhan, I'm going to start with you because I think one of the big questions that people might have is finding appropriate funders. So what advice do you have for finding appropriate funders, finding RFPs, awards, anything? How did you get started? How did you even learn of the opportunity you had?
Well, as a researcher and a palliative care nurse practitioner, I am very passionate about improving end of life outcomes, especially in those populations who are marginalized. As a minority myself, I have often felt the ill effects of discrimination and racism in healthcare, and I am very passionate and committed to addressing some of these issues individuals like me may face. So when I am looking for a funder, I'm looking for one who aligns with my values, one who understands the value in advancing the science and serious illness outcomes in end of life care. Someone who's just as passionate as I am about this issue. So basically that's what I look for when I look for a funder. One who makes it a priority to advance the science in serious illness, end of life, as well as those who are marginalized.
Thank you. And actually, I really like that point about matching passion with passion. And there definitely are funders out there that are passionate about reducing suffering, particularly in serious illness. But Siobhan or anyone, how do you find them in the first place? Lauren?
So I tell my grantees to look at other organizations like yourself or other researchers like yourself and see who's funding them. Mm-hmm. And, go through and then see if there's any synergies and do your research because there's a lot that you might read that maybe says, oh, I'm a perfect fit, but not necessarily. So that's one thing. I also suggest getting on lots of lists, other organizations like yours, and, they'll have an announcement, that's one way. But also some of the associations and national organizations and local organizations, because definitely they do funding announcements, or they say that someone got funded or that they got funded. So I always find that that's a nice way to sort of start the process. There's obviously also like Candide and the Foundation Center and places like that. Again, it might look like an organization is a perfect fit to get funding from, but you really have to do your research on the organization to understand.
Those are some great tips. And yeah, that's a good example of getting on lists. Just to put a fine point on finding local funders, I was wondering if we could explore that for a minute. Mary, can you start?
Sure. Local foundations are an excellent source of funding. And what sets them apart really is that they're deeply connected to the communities they serve. So it's a little bit different focus than a national foundation might have. There are lots of funders networks that you can, just Google funders networks in your area with palliative care or another type of maybe healthcare, or just funders in general. In Minnesota, for example, we have the Minnesota Council on Foundations. It's all of the foundations supporting work in Minnesota, even if they aren't located in Minnesota, but they fund there. But of course, it does have all of the local funders. It's a searchable database. There are statewide networks, and there are even regional networks. There's the Central Minnesota Funders Network. So look for funders networks to get in touch with what may be smaller organizations with smaller dollars to spend, but they are committed to making a change where they're located. And if that's what your program is about, you may find a good match there. There's also community foundations, which these organizations collect local funds then to be redistributed to local nonprofits. They're a good resource for dollars. And even within the community foundations, you often have donor-advised funds. Now, you don't often know what those donors are hoping to support, but by having conversations with the community foundation, they'll be listening to what you're saying. And if they have a match, they'll be the ones to, maybe make that connection. So look for the local community foundations. I'm also found that local healthcare organizations and even health payer organizations have their own foundations, which in turn put money back out into the community through nonprofits to accomplish the mission that they are about through the works of great nonprofits in their local community. I'd also recommend that when you're doing this search, to look beyond palliative care as your search topic.
Yes.
Look at healthcare, look at aging, look at equity, look at specific populations that some foundations might be wanting to serve that your program would serve. So you may find that there's a good match with a local funder when you view the work you're doing through different lenses. It's not just palliative care. It's also healthcare equity. It's also serving particular populations, et cetera. So lots of things happening at the local level that may provide some opportunities you wouldn't see on the national level.
Thank you so much. And just to add, yes, I've had luck looking in cancer, looking in heart disease, looking in lung disease, aging, definitely. So thank you. And the local perspective, absolutely. Anyone else?
Also, the local funder, since I am one, we talk to each other. We co-fund together. I have many examples over the last few years of working with 1, 2, and I have one example of 4 foundations working together on an initiative, and everybody is coming to the table from a different perspective. Back to your idea of like, it's not only about palliative care. All of the things that Mary described, we each have sort of a different look of where we are an older adult funder, but one of the other funders at the table is a New York State funder who's interested in health equity. And the funders also might say, like, I can't do this $500,000 project on my own, but maybe the community foundation will want to partner with us because I know that they're interested in this.
Rachel, when you put out your call, I forgot when it was, but it feels like a year ago, CAPC was able to get that through in our newsletter, and I'm sure there's others. What about Mary or Rachel? Do you have any other advice on this?
We do rely heavily on national organizations like CAPC to get the word out, as Lauren stated. We also send our RFPs, our press releases, out to our current group of grantees and tap them as ambassadors to share the opportunity. As Lauren said, a lot of time it's taking a look back and seeing who's funded by what foundations. So we look closely to our grantees to do some of this work for us.
Great. Well, actually, that's probably a great segue. So someone hears of an RFP or did their research, then what? What do you do? Mary, maybe you can start on this one. How would a program first approach you?
Good question. I think most foundations, I know Morgan Family has direction on our website about how to contact us and how to approach us. So it is important to do the research and understand what the process is. For our organization, our end of life grants the applications are by invitation only. But as we state on our website, you're welcome to contact us at any time throughout the year. So we invite emails, simply just starting a conversation to understand better whether an organization's program or idea matches our funding focus. I often get emails, sometimes even phone calls, and we can assess whether or not this warrants further conversation. And then for us, those that do warrant further exploration, we will invite to submit a full application. Depending on the foundation, they may have you send an LOI, a letter of inquiry, or a letter of interest with a brief summary of your program, your proposal, and then that, if selected, might be followed up with a full application. But once you've got your ideas together and you've identified some potential funders, look at their protocol for contact and follow through on that. But don't be afraid just to reach out with an email and ask a question, have a conversation. Foundations are typically friendly places and will be very honest and respond to inquiries, even if they're outside the normal process that applications go through.
Actually, thank you, Mary, for saying that. I've heard among my colleagues throughout my career that, oh, it's invitation only, and then they stop. So I appreciate you saying, well, just ask a question and see if you can get started. I thank you. Any other comments on approaching?
I want to reiterate what Mary said, because I didn't say it when I was talking about research. I mean, we also might have another funder in mind that might work better for whoever calls us. So we actually say on our website, please, call us before you do anything. And I agree with Mary that we're pretty friendly.
Yes, I find you all very friendly. Okay, let's move on a little bit. So someone has found a funder that they think matches their passion. They've made the connection and have gotten a positive response to send something in writing. So either for a letter of inquiry or a proposal, what makes a strong proposal? What are you looking for in the organization or in the program? Sometimes I ask this question of what makes your heart sing as a funder? Lauren, I'm gonna start with you.
So when the first thing is leadership support. We'll get to sustainability at some point, but that's very important to us, and it's very hard to sustain a palliative care initiative without leadership support, and it's really seeing the vision for palliative care. The other thing for Samuels in particular is that we don't fund 100% of a project. So, we're looking for, we say, skin in the game from our organizations. And again, that goes back to support, that, the institution is also in involved in the funding for this project. Also, we're a relatively small foundation. We fund $4 to $5 million a year in our overall healthy aging program each year, probably about $1 million plus, really focused on palliative care. And so we can't afford to fund projects that are creating the wheel. There are plenty of other foundations that are interested in, more research-based programming, but that we're really a direct service foundation and fund most of that work. And so, sort of what's been out there, what are you improving on, what are you growing? Again, that's for Samuels in specific. Having a track record of starting programs and growing programs is important to us. And also having clear goals and a sustainability plan.
A question crossed my mind as you were speaking, Lauren, and I'm going to turn to Siobhan just quickly. That idea of showing leadership support. So we know that a lot of palliative care programs are a program within a department, within a division, Siobhan, maybe you could just quickly talk about how do you show leadership support as a further down in the hierarchy?
That's a good question. Especially in my research environment, palliative care is a very small space. So actually, it comes down to me networking to find areas on campus. We have a vast campus, a lot of resources, a lot of support, but just finding the actual area on campus or the actual department, the actual program who supports my research interest, my research area, and working with them, looking at their resources. A lot of different departments on campus have centers with research support. So if it's not in the School of Nursing where I'm housed, it may be in another area, such as the community-based intervention area or the cancer center. So just going across campus, networking, finding individuals committed to the work that I'm doing.
That's a great point. And I'll just add, particularly with the issue of equity, there are a lot of institutions that are setting up centers or individuals to advance equity, and that might be a good way to get leadership support. Thank you. I know I digressed. Rachel, I'm curious of your answer. What makes your heart sing? Because you're looking nationally, and the scope is obviously different.
Thanks, Allison. A couple of thoughts. First, the Rita and Alex Hillman Foundation is committed to improving the health and the healthcare of all people, but especially groups and communities that experience inequity, discrimination, and oppression. And we define this as BIPOC, the economically disadvantaged, LGBTQ people experiencing homelessness, rural populations. And so a strong proposal is one that really advances our mission. And we're looking for three key components. We're looking to see that it's nursing driven, that it's rooted in nursing's holistic and integrated approach to care. We're looking to see that it's focused on improving the health of marginalized populations. And we're looking to see that it's innovative, that it's bold, that it's creative. Other elements of a strong proposal, we'd like to see a sound evidence base. We like to see a strong execution plan. Leadership has been mentioned. We want to see that people are demonstrating the commitment and the skills. We want to see that a proposal is scalable and that there's a clear path to sustainability. Two things that make my heart sing. Lauren mentioned the first one. It's the institutional support. Really, does the institutional organization have skin in the game? And is that operationally defined in the proposal? We want to see specific support. And importantly, we want to see if it aligns with the home institution's own priorities. One other thing that makes my heart sing is when we see out-of-the-box partners. So we want to see that a potential grantee has surveyed the field and inventoried their key stakeholder and brought some folks that we might not have thought of firsthand to the table. So I'll give you an example. We funded the University of Pennsylvania for a low-income housing effort in Philadelphia, and they partnered with the USDA Forest Service to create a comprehensive data set of neighborhood-level demographics and health and safety characteristics. So it's really not every day that you see an urban academic institution partnering with the Forest Service, but these out-of-the-box partners can contribute to a more holistic approach, and they really can enhance the ability to scale and spread.
Thank you. That's really useful information. I'll just make a quick point. You talked about like a strong operational plan, and I guess I'll take advantage and underscore that point. I think there's a tendency among grant writers and talking to people who are free to correct me, where you explain the problem and everything that's going wrong and how this, whatever is going on, is something has to be addressed. And then you might throw in a line or two of how you address it. But I think what also makes a strong proposal is really giving a sense of what exactly the work you're undertaking is and showing how you plan, what are the activities, who's going to do what. Please correct me if you think I'm wrong, but I wanted to underscore a bit of advice that I sometimes give is that the project activities section should be bigger, should be the biggest section. All right, let's flip a little bit. We purposely chose all of you because of your interest in advancing equity. And I know this is a complex problem, a societal problem, and because of long-lasting structures, it might be difficult to move the needle on advancing equity. So for proposals that do have interest in improving things for marginalized populations, or maybe doing something systematically to undo some problematic structures, what makes an equity proposal stand out? Rachel, I'm going to turn to you again.
Yeah, thanks for the question, Allison. So in addition to our focus at the Hillman Foundation on nursing and healthcare, we have a real concern for social justice and for human dignity. And we invest in nursing-driven innovations as a means of advancing health equity and improving the care of marginalized populations. Because we at Hillman believe that by improving the care to marginalized populations, we can improve the care for all. So when we're looking at a proposal and assessing their ability to improve equity, we're really looking for strong evidence of engagement of the people served. So we're looking for inclusion. And we often ask, does the team include diverse perspectives? And are the members of the target community really meaningfully included in the design, in the implementation, and the evaluation of the project?
I just, we're a local funder, so geography is helpful to us. So we actually go and look for, in certain geographies, for organizations that are serving populations that are in need of palliative care. And so we don't have to look very far to find that. So, but we do that outreach. I would say that sometimes it's hard to engage and get everyone together to put a proposal together, given all the other things going on. I mean, this is a general issue but sometimes under-resourced organizations have a harder time putting a proposal together. So again, we really work hard with the organization to try to put together a proposal that is direct service that our foundation would fund. So I think that is an important part of the work we do. We also, maybe 20 years ago, we didn't fund this, but I definitely think we, as program people, we've become more educated. We fund the direct service, but we also fund that outreach component to a lot of the projects that we fund, because we have learned that you need to have unbillable, a time for providers to spend on that piece of this work. And that is very important.
I was just going to echo a bit of what Rachel said about the involvement of the communities served. And what I've found in a couple of our grants is what makes the difference is that they have engaged these communities. They have listened deeply to their ideas on solving the problem. I think our equity problems exist because they're so complex and there isn't a simple answer. So when someone has an idea, oh, here's a great way to uplift this particular population so that they are served more equitably in our healthcare organizations, the idea coming from the outside isn't always the best idea. And so we have found some really great impact when it all began with listening and then building ideas from there, including the ideas on how to implement the programs and how to follow them through and how to adjust along the way. So the whole idea of engaging the community, the diverse communities we're seeking to help, listening and involving them all along the way, I think is what really makes an equity proposal stand out, that it's formed with the community in mind.
Thank you for underscoring that. Again, Siobhan, maybe I'm throwing a lot of unplanned questions at you, but if you could comment on that, because I do, again, there's a danger that programs do learn, as you said, include the outreach, but it's more this thinking that like you have to go and get buy-in, not, as you said, Mary, not you have to listen and respond. So I don't know, Siobhan, what was your experience? I believe you did work with a community partner.
You're totally correct. So for my project, I'm working with the community in my local area. I am looking at the phenomenon of bereaved caregivers, and I'm looking at community members in different groups to understand the whole idea of the experience of dying, end of life, and bereavement in this community. So the different individuals, the groups that I'm working with are bereaved caregivers. I'm also looking at the experience from nurses who take care of these individuals and their families at end of life. I'm also looking at social workers and bereavement counselors, people who do the work with bereavement and caregivers after the death of their loved one. And because faith is a big component of African American caregivers and their patients and caregivers, I'm also working with faith leaders and chaplains to understand, get out the big picture of the experience. So really leaning in and making these individuals' stories a part of the work that I do, really listening and have them direct the intervention that I want to create based on their stories, based on their expertise.
Can I add that, these are some of the elements that really made Siobhan's proposal stand out. Her letter of intent and her proposal stand out was this broad definition of the team. It was an interdisciplinary team with the people served right in the center. And as well as, social work, nurses, the faith-based community. It was very comprehensive. In addition to her written proposal, we had a number of conversations with Siobhan up front about making sure that her work was aligned with our mission, and our mission was aligned with her work. And I think this goes back to our point about feeling comfortable contacting foundations and just making sure that you're all working towards the same goal. We're grateful that Siobhan reached out, and we're very proud to be supporting her work.
Thank you, all of you. That was really useful information. I'm going to go from the sublime to the practical now. Budget. Um, do you have any guidance on presenting the budget? Mary, if you could please start.
Sure. Well, I think, the very first step is to make sure that the amount you are looking for or requesting is in alignment with what the foundation usually gives. It's a big mistake to say, oh, our missions align, they're really behind palliative care, and I'm going to go ask them for $150,000, only to find out their biggest grant last year was $30,000. So first step, make sure it lines up, do your research and see what they've done in the past, and is there some alignment there. But getting down to the nuts and bolts of creating the budget, it's not just a list of your expenses. Your income is also very important. And I think, Rachel, you mentioned you want to see that and maybe Lauren did too, I'm not sure, what other sources of income are supporting this project or this organization in total. Are there other funders already on board? So your budget needs to include your income and your expenses for the project or the program. Or if this is a request for general operating support, then it's just the full budget for your organization. What I like to see is that the expenses are itemized in a way that aligns them with the goals or the objectives of the project. Lots of times it's just necessary to have administrative costs all listed. There's office supplies and there's utility bills and so forth. But to see that there's a particular line item for the outreach effort, there's a particular line item for the development of a curriculum, etc. So aligning the budget details with the details of the project make it much more relevant and easy to evaluate. It's important to include also, especially if it's a program or a project budget, the indirect costs. It's okay to allocate a percentage of your overhead or your administrative costs into the cost of a project. That's to be expected. So it's okay to include those. So I'm always pleased to also receive some sort of narrative that explains to me what assumptions were made, justifying estimates, just anything that makes the picture clearer. So I would say my advice on creating a budget is be as specific as possible. Be realistic. Don't inflate the numbers just to make it look better, but be realistic and be able to justify why you've stated what you stated. In addition to the budget for your particular proposal, most foundations will ask that you submit financial statements from the organization that reflect the financial health of the organization. So a P&L statement, a balance sheet, they're important that they reflect, as I said, the financial health of the organization, but it also shows that you have good financial management practices. So I would say be thorough, be precise, and be transparent. We've dealt with some organizations that are really new, really small, kind of grassroots. They're not familiar with creating good financial statements. And it's okay if that's your situation, ask for help. There's lots of, foundations are willing to work with you on finessing the statements so that they reflect what needs to be shared. But there are also outside organizations that are willing to help nonprofits create their financial accounting. So
that was great. I'll just put a fine point on the budget justification. In my experience, some foundations require it, and some require it to the point of we will hold 5 community events, and expecting 50 people and the catering is expected to be $35 a person, and showing the math all the way through, back to the point about researching what the foundation expects. But I don't think anybody should be surprised if they really have to mathematically justify what they're asking for. Rachel, Lauren, any other advice on the budget? Rachel?
Thanks, Allison. I think Mary had some really good points. I want to amplify one that she shared, because we find that a key and often overlooked component of the budget is that in-kind or matching support. And this is really vital to getting a sense of buy-in from the organizational partners. And I'll tell you that oftentimes potential grantees tell me that they didn't include this in their budget because they often don't have a hard cash contribution to the effort. And so I advise project leaders to really inventory all that their home institution or their partner organizations are putting towards the project. And this can be, office space, consultants, staff time, and that they should attach a dollar amount to attempt to capture, to monetize this in-kind support. Because as a funder, seeing this, I'm better able to assess the level of overall commitment to the work and how this might influence their ability to scale or spread the project.
I agree with 100% with everything you've said. I want to add, again, about communication. Call the program officer if you have a question. I have looked at plenty of budgets for my grantees for applications to other foundations or other organizations. Again, we are a resource, not just our dollars. We could connect you, or we could give you advice if you want it. And then the other thing I want to just say about overhead, it's kind of sticky sometimes. I mean, we have a percentage in our max. Some foundations do not, but ask the question, or if it's not in the documentation. I have asked other foundations this question. Most say, I sort of just go with whatever they have as long as it's not, 50%. So that's something to keep in mind. When we are working with hospitals and universities, they have crazy overhead and a whole, and so we definitely have a conversation. You should have a conversation with your program officer on sort of the attitude about that sort of very high overhead that is often seen in those. We are not a government funder, and so I think that a lot of universities are used to those larger numbers. I also like to say that again, because we're a direct service funder, we really are funding most likely a new staff person or pieces of people. And so it should be very clear on our proposals on what you're doing. The other thing I want to add to on the financial statements, again, if we're working with a large organization, what is the budget for the department or the area that we are funding? So let's say it's a palliative care team. What is the overall budget for the palliative care team? And you're asking us to add a physician, a nurse practitioner, a social worker, just so we have an understanding of sort of the magnitude of the work. And it also goes back to that in kind, because hopefully whatever we're doing is helping to lift the entire palliative care team in the example I just gave.
Thank you all. Really practical advice. I appreciate you sharing those thoughts. And while we're on finances, we've already used the word sustainability a few times, but I was hoping we could dive a little deeper into that. So palliative care doesn't have a strong payment model. Lauren, you said you're looking for outreach in your proposals, which doesn't have any payment model, although Medicare is now proposing to pay for patient navigation, which is exciting. But in general, what speaks sustainability to you? And Lauren, I am going to ask you to start, please.
I just, for context, we think of our proposals as a business plan. And from the beginning, we have always thought about billing, cost savings, cost avoidance, Not necessarily things that the CFO sees when you're asking for a new line item. And so having the discussion with whoever the financial people are, whether it's in your department or at the C-suite level, so that you are in agreement at the proposal stage on what sustainability looks like for your organization. We always say, we give you ideas, but what does your organization need to sustain this program going forward? What sort of data do you need to collect? So there is a lot of evidence about, for example, cost savings, but does your CFO, you believe that for your institution, that is a way that this can be sustained? And so it is a little bit of a back and forth, and really having the financial people at the table at the beginning. And on billing, yes, there is some billing, and we always push, but we want to know that you actually are going to bill, because believe it or not, that not every department bills, and collecting, and so also understanding that piece of it. And then the other thing that is an interesting piece, and again, we don't really fund research, but a recent project that I just had, one of their pieces of sustainability, that by adding this social worker, they were going to not only engage more people in their research, but be able to support people who maybe would have not stopped being part of the research study. And so this organization, in their final report, actually documented a $300,000 increase because they had more patients in their research programs. So that was a new sustainability piece for Samuels.
That's fantastic. I'm just going to take this opportunity to make an extra point on what you pointed out, which is billing. There is a gap often with palliative care programs, but I think most leadership, and now it sounds like most foundations, do want you to optimize your billing. You shouldn't be asking for institutional support or foundation support if there is a revenue stream. And the idea for these other funding streams is to bolster that or make things more efficient. So I just wanted to make that point. Rachel, Mary, and Siobhan, any comments on sustainability?
The Hillman Foundation is pretty rare in the world of philanthropy, in that we're one of the few funders, together with the Arthur Vining Davis Foundations, that has a grant program that's dedicated to supporting pre-evidence work. So we support programs focused on the seriously ill and those at the end of life. We provide them up to $50,000 to build the evidence base for a model of care. So these are obviously programs that don't have a strong sustainability plan. But what we're looking for is innovation. We're looking for bold ideas, and we're looking for this focus on a marginalized population. And as Lauren said, we want to know that the applicant is thinking from the very beginning about their business plan and about how to scale and spread the model.
Yes, it is funny how, these business skills are really integrated into just everything that a program does. So thank you. Last, to wrap up, we covered a lot of ground. We talked about finding potential funders, approaching them, putting together the proposal, the best practices in working with communities, budget, sustainability. I guess we covered a lot, but I'd really especially love to hear, just open the floor for what you would like this field to know about foundation funds, and what advice you have for people going forward. And actually, Siobhan, I'm gonna start with you because you're the doer.
For me, what I found just in the general area of foundation funds, a lot of the foundations are very committed to especially in my instance, palliative care, end of life, working with marginalized populations. And just to expand on Rachel's point a little bit, my work is pre-sustainable. It's doing the research, exploring the phenomenon in order to build an evidence-based program. And it was really nice that this foundation actually gave me space to do so, space when there's really not funding for what I'm doing. There's really not funding, but like payment models. There's not a lot of programs centered around what I want to do, but I just want to explore this topic to understand if this would help advance outcomes with bereaved caregivers, looking at different perspectives. Also, what also was important is that the foundation really had an understanding about the key players in palliative care and end of life and serious illness, working with caregivers. And when I say key players, I mean community members, and just allowing me the space to really give good incentives when I'm working with communities and asking them for their time, effort, asking them for information, holding them as experts. They really valued a good incentive model for me to really pay back those individuals who I am gathering information and expertise from. So that's a little bit about my experience.
That's great. And I just want to add a comment on that pre-sustainability support. It sounds like, though, what you did was put a proposal together that made sense. You knew your problem, you knew who the right collaborators were, and you probably articulated, we didn't really talk about this, but you probably articulated your outcomes well, both in terms of SMART goals. Let's see if I can do this: specific, measurable, actionable, relevant, and time-bound, if I got that right. And again, we have other TA that goes into this, but that's very important that your goals aren't just, oh, I want to make things better for Black families. You really have to get to numbers, get to how long it's going to take, et cetera. My point is that you shouldn't be scared necessarily of coming forward with a pre-sustainability program, but you should be crystal clear on your outcomes. I'm going to turn to Mary.
I would just reiterate the need for relationship building, for networking, getting to know the other nonprofits that are working in the same area as you, getting to know funders. Building those relationships is really the key, because you get to have the conversations and bounce ideas off of one another and get feedback. And it's been amazing to me in my short time in philanthropy how, I might call Rachel with a question and she's got an idea and it sends me to Lauren, and Lauren's got an idea, and I circle back around to a grantee partner who tells somebody at their next network meeting. And it's really about relationships. I want to encourage everyone not to be afraid to start a conversation with a funder, with another nonprofit, with an outside agency that's offering help. I think it's all about networking, relationship building, and working through our great ideas together, because I think we all have the same end goal. We all want things to be better. And when we recognize that, I think we start having really juicy conversations that lead to good outcomes. So my biggest piece of advice is keep talking to one another.
That is foundational. Thank you. Lauren?
Again, Mary and Rachel, you take my words out of my mouth, but we are looking for long-term relationships, straight to Mary's point. We don't want it to be one grant and done. So we, assuming that we have some organizations that we talk to for a year or two before we even give them a grant. So, I can't emphasize enough sort of building that relationship and not being afraid to call and just checking in. I would say it works the opposite way when all of a sudden we get a call like, oh, like we want a grant, we'd rather sort of just know what you're doing and sort of keep the dialogue going. So I think that's very well said. I also agree that, talking to other like organizations, which brings me back to sort of what I was saying about looking for grants, but really understanding they're not your competitors. There's that, we're all in this together, especially in this particular area, to grow the field. And we have many examples of somebody coming to us and saying, we want to do X. And we say, oh, we just funded somebody else to do that. And they talk to them. And that proposal is so much better because they've sort of have that insight from somebody who's maybe a year or two ahead on it. And also for us as a foundation, I'm like, wow, he called, who I told him to call, and he seems to be dotting all his I's and crossing all his T's, which is another sort of nice thing for a foundation to hear.
Mm-hmm. Rachel, I'm just going to interrupt for 1 second because I want to pick up that point of, oh, we just funded that. Or I do understand the point about relationships and making things stronger. I'm going to be a little provocative, Lauren, because on the side of looking for grants, it does feel competitive. And if you might be a little bit of an outlier in that, oh, we just funded that, therefore we're interested in what you're doing and we'll go forward. So I wonder, Lauren brought it up, but I want to hear everyone's opinion. But it is competitive, and there is a limited amount of dollars and probably more people interested in being funded than there's available funds. So I guess just to comment on that really quickly, because I'm sure it's on people's minds. And Lauren, since you brought it up, I'll start with you. But
yes, I think we are an outlier. We also will fund the same organization, more than one project at the same time. And some of my colleagues in New York, I know that they don't. And they have a lot more money than us. So so that's fine that we're an outlier. We don't mind that. I would say that, we have, no deadlines. And so we're always talking to people. Projects fall off the calendar for the next board meeting. We always have something to put in its place because we're always working on 2 or 3 board meetings ahead. So again, maybe we're an outlier there. I mean, some of my New York City colleagues, I know that they're full like for the year. I mean, I have made calls for some of my grantees and said, one of my grantees is interested in approaching you. What do you think of this idea? And they might say it's not a good idea, or they might also say it's a good idea, except I'm full through 2024. So, again, we have a different approach. We're, if it's a good idea, we keep moving on it, and hopefully it will end up getting funded at some point. I want to actually add to that point about we will call other funders for our grantees, and that goes back to that relationship building. We feel, if we feel strongly about our grantee that we're giving them a grant, we should feel strongly enough to sort of make that call also. And that's another area where communication, talking to your program person, asking advice on other foundations.
I think you're hearing a lot of themes that our 3 foundations share, and that we're very person-centered. We're very applicant or grantee-centered philanthropies. This relationship is key. And I think that the takeaway from this is that program leaders should think of funders as thought partners who can provide resources beyond the grant check. We have missions, we have visions, and we are interested in using our resources and our opportunities to solve problems in collaboration with our grantees. I think you've heard both Mary and Lauren and Siobhan talk about how talking is key. We know that the needs of our grantees or applicants really can vary. So we at the Hillman Foundation listen closely. We ask questions because we want to understand the projects and we want to really see our grantees thrive. Lauren has shared a number of examples. We like to use that macro level perspective as funders to connect like-minded projects to inspire collaboration. We happy to introduce grantees to other funders, to write letters of support. We often support consultants before a grant is funded to help them kind of get their grounding. I recall once a grantee said, if I have a new idea, Hillman is one of the first places I started as a sounding board. And to us, that really makes us feel like we're doing our job well. In terms of competition, yes, this is a competitive process. We have limited resources and we unfortunately have to choose the ones that best fit our mission. And I think it's important for people to remember that the conversation is key. We at the Hillman Foundation oftentimes will have schedule a one-on-one conversation with applicants who didn't make the cut this round, but who were strong contenders. And we will give some personalized feedback to help them strengthen their proposal or their letter intent for the next round. And we often see reapplications that get funded sometimes the next year, sometimes years down the road. So it goes to this point about building relationships. It's everything.
Thank you so much for bringing up that point, Rachel. I personally have, every time I've been rejected, I do ask for the feedback, and the feedback has always been instructive. So maybe that's another tidbit of a to-do, to ask for feedback whenever you have the opportunity. I do definitely hear that the building of relationships is vital and that your foundations are really eager and approachable to build those foundations. I'll just add a caution that there might be others that aren't as eager and approachable. And in that case, you'll get the right vibe and you'll make the right decision and keep doing research to find places like the ones we featured here. Well, thank you all so much. I know I learned a lot from this conversation. I am expecting that our audience will get a lot out of this. I really appreciate your time. Thank you so much. Well, I want to thank our panelists so much for all their great insights, and thank you for watching as well. If you're interested in this topic on fundraising, particularly for equity initiatives, I'd encourage you to visit CAPC.org. We have additional resources that might help you with your letters of interest and proposals. We have information that can help you with your business planning and, of course, finding collaborators and much more. So thank you again for watching.